Good evening, class. My name is Jerome Uchenna. Today, we shall be discussing gestational diabetes mellitus. The objective. At the end of this lesson session, the students will be able to describe gestational diabetes mellitus and those at high risk of developing the disease condition based on risk factors. Make appropriate decisions based on clinical findings to safeguard lives of those at high risk for gestational diabetes mellitus by collaborating with other health professionals. Provide quality care to patients by using appropriate theoretical framework and evidence in managing those diagnosed with DGM. Explain the role of nurses as agents of health promotion in providing quality care. Definition. Gestational diabetes mellitus, according to American Diabetes Association, is defined as any degree of glucose or carbohydrate intolerance with onset or first recognition during pregnancy. This condition is usually diagnosed within the 24th and 28th weeks of gestation on the basis of abnormal oral glucose tolerance test. Risk factors. The risk factors that predispose women of childbearing age to gestational diabetes mellitus include family history of gestational diabetes mellitus or type 2 diabetes mellitus, maternal age of 30 years and above, overweight with BMI, body mass index more than 25 kg per meter square, ethnicity, Hispanic, African, Native American, Asian, Pacific, Indian ancestry, insulin resistance, previous history of adverse pregnancy outcome, or previous histories of stillbirth or newborn death, and multiple gestation. Pathophysiology. Glucose metabolism is facilitated by the hormone insulin produced in the beta cells of the pancreas, but pregnancy alters its effect due to the high level of pregnancy hormone within the circulation. This hormone, estrogen, progesterone, cortisol, and placenta lactogen in maternal circulation causes an insulin resistance and decreases its sensitivity to glucose uptake for cellular metabolism. As the pregnancy progresses, the hormone production increases, which leads to further insulin resistance, and this process is at its peak between the 24th and 28th weeks of pregnancy. Immediately after birth, when the placenta is delivered, pregnancy hormone production stops, and so does gestational diabetes mellitus, which strongly suggests that the hormone resistance to insulin is the major cause of the disease condition. Screening and diagnosis. The first method of screening for gestational diabetes is a non-fasting 1 hour 50-gram oral glucose tolerance test, followed by a fasting 3 hours 100-gram oral glucose tolerance test if the 1 hour OGTT is elevated. A diagnosis of gestational diabetes is made when two values are above the normal value for the 3 hours oral glucose tolerance test. The second method of screening is the single 2 hour 75-gram oral glucose tolerance test. Fasting oral glucose tolerance test, if it is more than 92 mg per dl, 1 hour OGTT, 180 mg, 2 hours, it is more than 153 mg per dl. Complications. The maternal complications include gestational hypertension, pregnancy-induced hypertension, cesarean sections, surgical site infection, thromboembolism, spontaneous abortion, hydramnios, hypoglycemia when using insulin, diabetes, ketoacidosis. Fetal complication. The perinatal complications include fetal distress, congenital malformation, macrosomia, birth trauma, intrauterine retardation, stillbirth, and newborn death. Upstream complications include obesity and diabetes in the future. Management of gestational diabetes. One is prevention by engaging in early antenatal care, physical exercises, and diet. Screening by using the 2-hour 72-gram oral glucose tolerance test. Health education on lifestyle, diet modification, exercises, glucose self-monitoring. Self-examination, diet modification and exercise, or education, a combination of exercises and diet. Medical management, the use of short-acting insulin, oral antihypoglycemic agents, such as metformin. Fetal management, by booking for elective induction of labor before 39 weeks gestation. Utilize expectant management in women with gestational diabetes mellitus. Conclusion: nurses should understand that they play an important role or integral role in the lives of women who are at high risk of developing gestational diabetes by helping them reduce the associated medical complications. The method of management for this condition remains dietary modification, increased physical activities, and appropriate weight gain during pregnancy through self-monitoring. That brings us to the end of this discussion. I would like to get some feedback or question from you students. If you have any question, feel free to answer it or ask it. I'll be here to clarify any of your concern. We're having not gotten any response from anybody. That means that we understood the lesson so far. Thank you so much, as this will bring us to the end of this discussion. Hoping to hear from you or see you in our next lectures. Thank you and have a pleasant evening. Good night.